Welcome back to the OHSU Effect Inside Health and Science. I'm Lacey Evans. We've been talking about personalized cancer medicine, which describes how a team of doctors at the Knight Cancer Institute tailor a patient's care specifically to their needs. And this segment, we're talking with Karen Brown. She's going to tell us about nurse navigators and how they are transforming the experience for cancer patients. Good morning, Karen.
Hi, Lacey.
So at the Knight Cancer Institute, nurse navigators are a centerpiece of multidisciplinary clinics where patients can see multiple cancer specialists at one time. So what is a multidisciplinary clinic and what does it mean for cancer patients?
That multidisciplinary concept is wonderful because what it entails is we might have 3 to 4 different types of doctors that are involved in the patient's care. Thoracic, for me, running the lung cancer program, thoracic pathologist, radiation oncologist, thoracic surgeon, and the oncology doctors that I work with, they're all together in one area. The patient has the ability to see all of those doctors in one day. And I remember, I'm an old enough oncology nurse, and I remember back in the old days, somebody would have to see the surgeon. Then about 2 or 3 weeks later, they'd get in with the radiation doctor. And then a few weeks later, into the oncologist. So 5 or 6 weeks would go by before we could get going on treatment. So this new concept is extremely helpful for the patient because what they can do is come in and see all of the doctors in one fell swoop. We have a lung conference at noon on our multi-D day, and what they do is they sit and look at the patient's images. They sit and look at the pathology. The doctors talk about what's the best pathway and safest pathway for the patient to go on. So by the time we come out of that conference, there's typically a game plan, and we can get started on organizing that game plan, which is part of what I do, which is help organize what the doctors think is the best path for the patient's journey.
So this sounds much easier for the patient and
Absolutely.
Yeah, and I would say less room for error in terms of communications between all those different doctors, right?
Mm-hmm. Right. Back in the old days, doctors to communicate, this was even before fax machines, is they have to call on the phone or write letters and things like that. So we now can make a decision, 100 times quicker than we could in the past, and time is of the essence. So we're able to have a game plan for the patient, typically while they're often in the office, and get going on treating them. So it's a much better avenue. It's a wonderful invention.
What is a typical appointment like?
A typical appointment is the patient's primary care doctor or another doctor that they're seeing in the area or out of the area will call and make a referral to our clinic. Or sometimes they'll call and I'll talk with the office and kind of decide if they're appropriate for my type of multidisciplinary clinic. And if an appointment is made, we can typically often be prepared, depending on what records we receive, what scans and images we receive, what lab work we receive, can organize an appointment for that patient to see the oncologist, the radiation oncologist, maybe even the thoracic surgeon. So we can organize that. So the patient will be given an appointment to come into the clinic, directions how to get there. They're probably going to be there most of the day, maybe 4 or 5 hours. And they also are aware that they're going to be able to see a lot of different types of doctors to help make decisions, therefore making it a long day, but an efficient day. So they'll come into the clinic. They typically check into one spot. They'll see those doctors in one area. We're not shuffling them all over the clinic or all over OHSU Hill, which is nice, but they can do it all in one area.
That's great. So who is eligible? You mentioned that when you speak to them on the phone, you find out if they're eligible for this multidisciplinary care.
Typically for the type of work that I do in oncology, we need to know, the first thing is we need to know what the diagnosis is, and then it's been proven with a biopsy or some tissue samples. And once we are able to know what the diagnosis is, so we're not accidentally or inefficiently maybe seeing a patient that is colon cancer, but it's gone to the lung. They're not really a primary lung cancer patient, which is what we would work on. They maybe should have gone to the colon multidisciplinary clinic. So we can make those decisions before they come in. What makes them appropriate and not appropriate is certainly a time saver for the patient too, because they need to get to a doctor and get a game plan made as soon as possible.
So is this care available regardless of the type of cancer?
Yes, well, we have lots of different multidisciplinary programs at OHSU. Many facilities do. So it is. I mean, it's appropriate for almost every type of cancer. If it isn't, we find a way to create a special program for them. If it's a really rare type of cancer, we like to work together to try and make it still some type of process where the patient can come in and perhaps meet 2 or 3 doctors that can help find a solution.
Yeah, and I know that the Knight Cancer Institute offers multidisciplinary clinics for breast cancer, prostate, lung, that's where you work, colorectal, liver, pancreas, sarcoma, and thyroid. So yeah, you're
That's
covering.
right. We got it pretty well covered.
Yeah. Tell us more about the nurse navigator role and more about what you do.
I think the nurse navigator role, the best way that I can describe it is this cancer journey is extremely scary, extremely complex, extremely confusing. And I look at my role as being the person in a scary journey and an awful journey that most people don't want to make, but if they need to, it's my job to make it a more decent journey and a more clear journey and a more not so fearful journey. And that's by education, helping with appointments, even helping them find where to go, get their prescriptions refilled for them, find a place for them to stay, hotel-wise, helping them with gas, just any kind of avenue that we can help patients, just make the journey easier.
Sounds like you do everything.
Oh, we sure try to, but there was such a need for that. That's why this type of job description popped up. It's just so complex and scary that there had to be somebody that helped them on the journey.
So how do you ensure that a person's treatment is personalized? And really, what does personalized mean?
Personalized means that, as you might notice with lots of multidisciplinary clinics, we don't just roll everybody into one pot and pick out and decide what to do, maybe 14 or 15 different protocols. We focus, and the group that I work with and the other groups at the OHSU, they focus on certain specialties. And so they become very good at those specialties. So personalized means that we're able to know exactly what type of cancer that we need to attack. We also can do some genetic analysis to help treat patients with the best drugs that are appropriate for them. That wasn't always the case in the old days. They used to have certain recipes or regimens for breast cancer and lung and colon. Now we have an opportunity with pathology and genetic analyses that we can really fine-tune to where everybody's not getting the same thing. We can treat different types of cells with different drugs that are much more effective.
Yeah.
So it's not, everybody doesn't get the same thing type of attitude.
Sure. And you mentioned drugs. So what about clinical trials? Would you have information on that and be able to steer a patient in that direction?
Sure, I do. I have a little bit of information on that. I'm not specifically involved with that, but I will let you know that at OHSU, there's also a designated lung cancer clinical trial nurse. So she's a navigator in the clinical trial world. And so that's specific and personalized and special also. But we work closely together, and so it's very easy for me to talk with that person. We talk about each other's patients and kind of decide what the best avenue is for them with the doctor.
Do you continue with a person after their treatment is finished? You don't just let them go, do you?
No, absolutely not. I spend so much time with patients. You get to know the family members, and they have dogs and cats and where they live, and they like to garden and different things like that. That it's really important for me on this journey to continue to make this journey is that I know that people are doing okay, and I check in with them, and we talk periodically, just so that's part of the reward of this job.
Yeah, it sounds amazing, and I would describe it as one-stop shopping kind
Yeah,
of.
absolutely. And in the old days, it used to be you'd have to run all over town, and that could take weeks. And again, time is of the essence.
Well, great. Karen Brown is a nurse navigator up at the Knight Cancer Institute at OHSU. Thank you so much.
You're welcome. My pleasure.
And we want to remind people about the half-hour documentary on the OHSU Knight Cancer Institute and its pioneering role in this personalized cancer medicine. It's coming up this Thursday the 7th at 7 p.m. on Coin Channel 6. And as part of the show, cancer experts will be available from 6:30 to 8 by phone if you have any questions. And Karen, you'll be on the phone?
Yes, I will. I'll be there.
That's great. That's great. Well, that number is 503-464-0505. And again, it's personalized medicine, ending cancer as we know it, 7 p.m. Thursday on Coin Channel 6. More of the OHSU Effect coming up next in 5 minutes.